All right, and speaking of masks, they were the animating feature of Dr. Fauci's interview with Facebook CEO Mark Zuckerberg. But did Fauci hit the mark? Here now is Dr. Ramin, Oskoui, cardiologist, CEO of Foxhall Cardiology. Dr. Oskoui, you just heard Governor Kemp. He said that, look, if young people wear masks and socially distance, they'll have a better chance of having a football season, going back to college. And that's fine. I think, people are going to try to do what they can do. But we've already exposed that the science behind regular cloth mask wearing, not surgical mask or the N95s, is a little dubious. So in this interview we were talking about with Mark Zuckerberg, Fauci strongly recommended mandating masks, including ones that are not medical grade. Watch.
The recommendation was not to wear a mask because of the shortage of it. Two things happened. One, it became clear that we had enough of the equipment, so there was no shortage. It became clear that cloth coverings that you didn't have to buy in a store, that you could make yourself, were adequate.
Okay, that's the rub there, is it not, Dr. Oskoui? Are cloth coverings making people safer and adequate?
I think the short answer is no. There actually are studies that have shown that cloth masks are next to worthless. And there is some question whether by holding on to those particles, you may actually be making yourself sick.
Or certainly more susceptible to getting some of these viruses. Was that Vietnamese am I getting that right? Okay.
It is, yeah.
All right, Zuckerberg also asked Fauci this question.
Breathing in more carbon dioxide? Are there any issues like that? From all of the studies around this, has anything negative been found?
Not at all, Mark. There has not been any indication that putting a mask on and wearing a mask for a considerable period of time has any deleterious effects on oxygen exchange.
Well, that's maybe on oxygen. That is correct?
That's correct for most patients, but there are some patients who are a bit fragile, those with emphysema, where wearing a mask could possibly be problematic. Yeah, that's not entirely true.
And it looks like the concerns we had on the show about the accuracy of COVID death counts, Dr. Oskoui, and you've been part of this conversation for months now,
sure,
that were well placed. An investigation by Fox Orlando is now revealing that a victim of a motorcycle accident was actually labeled as a COVID death.
We're discussing and trying to argue with the state, not because of the numbers. I mean, it's 100. It's not make any difference if it's 99. Yeah. But the validity that the fact that the individual didn't die from COVID-19, died in a crash.
First of all, I can't hear what anyone is saying in a mask, number one. Number two, Dr. Oskoui, how pervasive do you think reporting errors like this are? Is this just a one-off?
I don't think it's a one-off. I think what HSS has to do is audit every COVID death and every COVID diagnosis of every hospital. Remember, we're paying bonus money to patients who are intubated for COVID and who are diagnosed as having COVID in the hospital. That's coming to hundreds of millions of dollars. I think so the American people don't get cheated, these hospitals need to be audited. Every single one of them, every single case.
The hydroxychloroquine study, Dr. Oskoui, that was touted by CNN as showing, see, we told you so, no benefit to hydroxychloroquine, 15 seconds. Why was that junk?
Well, it's a small study. Interestingly, underpowered by Boulware's own admission, and as you see, with an intention to treat protocol, they had a 60% reduction in mortality. There are much better studies, much bigger studies that clearly show efficacy in the same population.
Yeah, and actually talk to treating physicians, let them make their own decisions since the drug is very safe. Dr. Oskoui, as always, invaluable analysis. Thanks so much.